Good afternoon, everyone. I'm Louise Blasius from McKenzie Health System, and I'm thrilled to welcome you to Healthy Living Together for today, October 20th, as we look at Medicare and you. Just a few housekeeping regulations. Your audio is automatically muted. Speakers are very happy to accept your questions and answers. Just click on the bottom of your screen and use your question and answer box. And then we are recording this video, and Nina Barnett from Public Relations will email out the YouTube link for us. I'm also pleased to say that I'm a certified Medicare Medicaid counselor. I have been since February of 2017. I was trained by Region 7 Area Agency on Aging. I'm also pleased to introduce Christy Etter. She is our collections specialist in the finance department for McKenzie Health System, and she is beginning to work on her Medicare Medicaid counselor training as well, and that'll be a great addition to our team here at McKenzie. And I'm going to start by sharing my screen and talk about your Medicare options. Today, people have two ways that they can choose to get their Medicare. They can have original Medicare, and that's Part A. And everybody who has work credit can be eligible for Part A at no cost. And Part A covers inpatient care. It does have a deductible every 60 days, but it's recognized anywhere that takes Medicare. And then Medicare, original Medicare, also has the second part that's known as Part B. And Part B covers emergency room and outpatient services. It has a 20% copay and an annual deductible. Most people sign up for Part A and Part B. And then in today's world, people are also adding Part D. That's for a Medicare drug plan. And very important for everyone to understand this year is if you're a senior on Medicare and you're diabetic, and you have to take insulin, there are several drug plans that have been approved by Medicare, and the fee for insulin can be no more than $35 a month, which is a great cost because insulin prices have skyrocketed. Also, people typically like to sign up for a supplemental plan, and this covers the co-pays and deductibles with your Medicare Part A and B. There are some exceptions to enrollment, but basically you can get the supplemental coverage when you're first eligible without being risk rated, but you can only do that once within your first 63 days of signing up for Medicare Part A and B. If you switch your supplemental coverage plan after that, insurance companies can prior rate you based on age or pre-existing conditions. And these plans, Medicare Part A, B, the drug coverage, and the supplemental, typically do not offer dental, vision, or hearing. So now sometimes people like to look at a Medicare Advantage plan, and that's also known as Part C. And a Medicare Advantage plan typically covers everything that Part A, B, and usually Part D, the drug plan. And they will also many cover the out-of-pocket costs that original Medicare doesn't cover. And many of them now offer vision, hearing, and dental services. So a lot of seniors like to sign up for an Advantage plan, but it's very, very important to check that your doctor, your hospital, and even eventually down the road, your nursing home of choice accepts this Advantage plan. And anybody who would like an appointment to come in and see me is always welcome to do that. Now, there are special times of the year that people can sign up. And Christy Etter, would you please tell us about Medicare open enrollment times?
Sure, I'd love to. Thank you, Louise. Medicare does their open enrollment period between October 15th and December 7th every year. This is a good time if you're newly signing up for parts of the program that you missed during your initial enrollment period. Other options that you have, you can switch from original Medicare to an Advantage plan if you'd like, or you can even go back to original Medicare from your current Advantage plan. This is also a great time to sign up for Medicare Part D drug prescription coverage if you didn't do that in the past, or you can change your Part D coverage. Another thing to consider is that even if you are currently pleased with your insurance plan, it's still a good idea to review it to make sure that the plan that you have still meets your needs as they've changed over the past year.
Thank you. And now I would like to share my screen again and talk about our current open enrollment time, which begins October 15th and it ends on December 7th. So in your prescription drug plan for 2022, there is a total deductible of $480. After that deductible is met, depending on your drug plan, you may have a 20% copay unless you fall into the donut hole. Originally in the donut hole, people had to pay the full cost of prescriptions themselves, but now it's limited to 25%. And then after $10,690 has been spent, you're back in full coverage. And you can also get catastrophic coverage, which is only $3.95 per prescription. In 2022, then, the prescription drug plan deductible is $480. And during the open enrollment period, it is fine to switch drug plans. It's also important to know if you don't sign up when you're first eligible for a Medicare prescription drug plan, there is a penalty fee. It's based on the average premium of $33.37. And then it's a 1% fee for every 24 months that you didn't sign up. So in this example, the person would have a drug penalty fee of $8.01 added to their premium. So it's a good idea to sign up as soon as you're eligible. And the Part D premium in 2022, as I've just mentioned, the average premium is $33.37. If someone is low income, their bench rate is based at $31.49. Everything that I talk about today can be viewed at Medicare.gov, or if people come in and have an appointment, I'm very happy to walk them through Medicare.gov and looking at their drug plan choices, their Advantage plan choices, and their supplemental plan choices. And they'll soon be star rated, like 3-star, 4-star. So that'll be more user friendly. This is where to go for that Medicare plan finder. As I mentioned, it's Medicare.gov. And just as an explanation of what is covered in medication, Part B, your outpatient coverage, takes care of the flu, the pneumonia, the hepatitis B, and the COVID immunizations. Part D, the prescription drug plan, covers all of the other vaccines, whether it's tetanus or Shingrix for the shingles. There are lots of annual medications that seniors need to check and see if their vaccines are up to date. You can change your enrollment up until December 7th. And then you would have a change opportunity again with annual enrollment. And it is true, the last enrollment is the enrollment that will count when you choose your drug plan. People also can add Medigap riders to their supplemental plan. They can add dental, vision, hearing, and even some of the fitness gyms will take health insurance for membership coverage. And then I can help, the SHIP program can help, Sanilac Pharmacy helps. People can put in all of their medications and then find out what drug plans cover their medications that they need, and you can make sure that they're available locally and conveniently for you. Drug plans with no deductibles can include SilverScript, WellCare, the AARP Medicare RX, and the Prescription Blue Premium Plan. Other drug plans offer programs with premiums less than $25 again. And here we see SilverScript, WellCare, ClearSpring, Elixir, and Humana Walmart plan. So the least expensive premium could be at $7.50 a month, and the Prescription Blue Premium is at $113.70 monthly. So wide variation to look at, but we can do that online. Some drug plans that have dropped out of the market for 2022 include Express Scripts, WellCare, and then WellCare is adding a Medicare RX option. And low-income seniors have some additional options that they can look at, and happy to help with that research too. Advantage plans are offered by a wide variety of providers: Aetna, Ascension, Blue Cross, HAP, lots and lots of choices. But again, we want to make sure that our physician, our hospital, and our nursing home of choice accepts that insurance. And I'm going to try and come back on screen now. Somehow I've gotten lost. There I am. Thank you. Happy to be back. And I'm happy to answer any questions that people would like to submit. I think the thing that I would most like everybody to remember is if they're on insulin, there are drug plans that will offer insulin at $35 or less per month. And I want to remind everybody, when they are first eligible for Medicare A and B, they may sign up for a supplemental plan, and it is that first time 63-day window when you're first eligible for A and B that you can sign up with a guaranteed issue right for a supplemental plan. So that means no matter what plan you choose, they cannot prior rate you based on your age or pre-existing conditions. Should you switch from there in the future, and you wanted to go back to a supplemental plan, you could be prior rated. I have a question here. This is a great question. What does a supplemental plan cover? It covers your Medicare deductible. It's approximately $1,400 every 60 days. That would be an out-of-pocket expense unless you had a supplemental plan. If you just came to the emergency room because you needed that care, you would have a 20% copay, plus there's a $482 deductible annually on your Part B. So to avoid that 20% copay and the deductible, it would be a good idea to sign up for a supplemental plan. So that's what a supplemental plan does for you, is it takes care of your Medicare and A and B copays and deductibles. I had another question on what drug plans are offering the $35 maximum. That's called the Medicare's insulin savings plan. And if you go to medicare.gov and put in your meds, you can pull up the locally available drug plans with insulin. Any other additional questions right now? Our next healthy lifestyle class, our Healthy Living Together, will be November 17th. And I'm really thrilled to say we're welcoming Chef Aaron Puzan back again on Holiday Cooking with Kids. He does a wonderful job teaching children how to cook. And he is the executive chef at Autumnwood. So we're very lucky to have him join us. Anything else you would like to add, Christy?
No, you pretty much covered everything I could think of, except I think as far as that first question, it should probably be noted that in the case that you have a Medicare Advantage plan, you don't have a need for the Medigap policy.
Right, you can't have both. That's an excellent point, Christy. In order to sign up for a Medicare Advantage plan, you have to have Medicare Part A and Part B. Only then can you switch to an Advantage plan. And it is totally illegal for insurance sellers to sell someone an Advantage plan if they have a supplemental plan. And if somebody is feeling like they're being taken advantage of by a high-pressured salesman, you can also call the Medicare Medicaid program locally. That's Louise at McKenzie, 810-648-6181. It can also be Region 7 Area Agency on Aging, and they staff the programs too. And their phone number is 1-800-858-1637. And it is not right to be pressured or feel like you're being pushed into a plan. I had one gentleman, he had a neighbor sell him an Advantage plan, which he bought, and then the Advantage plan was not accepted by a local nursing home, so he had to go further away. So don't allow yourself to be forced or pushed. And of course, our mail today, you can't go to your mailbox without half a dozen or more flyers on insurance. Another question is, are the Medicare Advantage plan deductibles and coinsurance and co-pays the same as regular Medicare? And the answer is no. That's the reason why people are typically stepping up to an Advantage plan. They want to walk away from all of these individual fees that they experience. One typically keeps paying their Part B premium, that goes to the Advantage plan. And then some Advantage plans have no premium and some have a premium that's also involved. And another question, without a supplemental plan, I would have to pay $1,400 every 60 days that you were hospitalized. That is absolutely true. Very true. And let me look up the exact amount of that deductible if I can for you. 1,484 days per benefit period, and a benefit period is 60 days. Also, without the supplemental plan, a person would be paying 20% of an emergency room visit or an outpatient visit at a perhaps a specialist's office, as another example. Okay, any other questions, folks? All right, you've been a terrific audience. Watch for your email from Nina Barnett, and you'll see this on YouTube. Call us at McKenzie, ask for Louise or Christy at our main number, 810-648-3770. And we're happy to be of continued help. And for fun with the children or the grandchildren, join us again on November 17th with Chef Aaron Puzan from Autumnwood, Holiday Cooking with Kids. Thank you, Kara Boom, for being our recorder for this event. Kara is a social work student with us from Indiana Wesleyan University, and it's been a treat to have her here with us here at McKenzie. Thank you all. Stay well. Sign up if you need to. Check your plans. Bye.